Greetings to all the viewers of PhysioTV, and I, Dr. Prajakta Sahasrabudhe, from Sancheti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy, welcome all of you to today's session of PhysioTV. With me today, there is a senior clinician in the field of cardiopulmonary rehabilitation, Dr. Asawari Page. She has worked and developed various cardiopulmonary rehab setup from basic to advanced. And I think to talk on this particular subject, we cannot have a better faculty than her, because her tips, her first-hand experience is going to be very handy to the new aspirants who wants or who wishes to develop their own setup in the field. She is working in the field since more than 15 years now. She has worked with various cardiac rehab setups, hospital-based as well as OPD-based. Currently, she is executive committee member for CVPR Society for Pune region. And currently, she is practicing at Prabhat Road as a cardiopulmonary rehab specialist and fitness expert. I would like to specially mention that she was part of the core rehabilitation team for our ex-Prime Minister, Dr. Manmohan Singh. So I think she's a very renowned name in the field of cardiopulmonary physiotherapy. Welcome, Dr. Asawari.
Thank you.
And without wasting any further time, over to you.
Yes, thank you, Dr. Prajakta. Thank you, PhysioTV. Thank you, Sancheti, for giving me this opportunity to have me on this platform. And I am really delighted and my pleasure to be here.
Same here.
So can I share the screen?
Yes, ma'am. You can share your screen.
Yeah, can you see?
Yes.
Okay. So hello, everybody. And let's get on to the topic, as the topic is of cardiac rehab setup from basic to advanced. And today what I felt was I'm going to concentrate a lot on more practical and clinical tips about setting up a department, rather than going a lot into academics and research oriented, because that anyways you can read and look into the research projects yourself. But the first-hand experiences matter a lot. And I feel when we were, I'm sure Prajakta would agree with me, that when we had selected cardiopulmonary physio like 15, 16 years back now as our elective, being the topper of the class and still being taking this as one of the master's topic, there was not much scope at that time. But now cardiac rehab has evolved in various fields, and almost all the hospitals, either small or big, any cardiac setup, there is this cardiac rehab awareness which is coming up, and it is spreading real good. So which is why this topic is of utmost importance. And as we all know, cardiac rehab is a coordinating, multifaceted intervention which is developed to optimize cardiac patients' physical, psychological, social functioning, so that they may resume their normal place in community. And an enthusiastic aspiration to establish a center where comprehensive cardiac rehab facilities are accessible to ensure long-term patient care under one roof. So it is very essential to have facilities which will have, a comprehensive setup with all the core components, as we always say, to be under one roof and to be in coordination with each other, because ultimately it's a team effort. Cardiac rehab is not just about exercise, it's not just about nutrition, it is not just about medicines. It is a combination of all the team members working together for patients' benefit. So it is very essential for us to be in coordination. As we all know, there are these major setups. So inpatient cardiac rehab is, I think, the most established setup, touchwood now. And most of the hospitals, as I said, small scale hospitals, large scale hospitals are very much well versed with an inpatient cardiac setup or cardiac rehab, and they're doing really very good to get the patient back to their normal quality life within like a week's time. So that part is really well established. Then comes the outpatient cardiac rehab. Of course, there are two broad categories, I would say. That one which is majorly hospital based, as most of the cardiac rehab setups are, because of the fact that we need um, a kind of emergency setup for it. So you really need to have an emergency team with the emergency facilities like a crash cart or a defibrillator or a suction or an I would say the monitoring devices, everything ready, handy if anything happens there. So if a person has a syncope or a person goes into arrhythmias, or if a person just falls down, so you need to have certain access to emergency services, and that's the reason most of these setups are hospital based, where you have all this access. But yes, there are certain standalone centers which are coming up, which are making sure that they do have their emergency setup ready. They do have the staff that is qualified enough for BLS, ALS, if not ALS, I would say at least the basic life support. And they make sure that their center is closer to some tertiary care hospital where the patient or the person can be, the individual who suffered can be moved to quickly after stabilizing at their center. So these standalone centers are definitely coming up. But yes, there are barriers, there are challenges for data monitoring, and most of the other things. We can actually have a different talk on the challenges and the barriers that we face. But the standalone centers are also coming up, which is a big thing. So as we say, there are results from the ICCPR global audit, which we can see that it was a cross-sectional study, which I came across, and it was an online survey, concluded that of all countries in that audit, the greatest need for CR existed in India. And this article also concluded that programs must be financially supported by government, which we know we are still paying out of pocket for all the cardiac rehab services. Although there are certain, I've come across certain insurance companies or certain companies which do reimburse, and then we need to give them the details of the sessions that the patient has attended. But there are very few of them. But I'm sure the awareness is increasing because all the insurance companies, when we had a huge interaction with them last year, but the major barrier was the lack of documentation that we have. So we all have to kind of focus on, of course, yes, patient treatment and assessment, but we also have to focus on the data keeping, the documentation of each and every stuff. So that is very essential, because unless we have a huge data, the insurance companies really cannot do anything. So we have to really work on that field. I think we have quite good through the clinical part, but I would say the documentation part, we still are lagging behind. So the number and the capacity of CR centers in India were grossly insufficient to meet the demands. The statement that JACC, the Journal of American Cardiology, recently gave, and I really liked it, that it is time to rebrand and reinvigorate. So despite the strong evidence of CR in the secondary, this thing remains, but still CR remains underutilized, as you know, because of significant barriers. And the current mode of delivery is unsustainable and needs improvement to provide cost-effective, patient-centered, and more comprehensive programs. So this session, I want to make an appeal to all the cardiopulmonary physios to come together, and we formed this SOCVPR society. So do join us, do join hands, so that we can get this change in the society, right? So let's come down to the basics of it. So what are the basic requirements when we are setting up a cardiopulmonary, or I would say a setup for cardiopulmonary individuals? We have to actually look even more than this, I feel, and we have to look at the broader perspective of cardiopulmonary rehab, that is fitness. So we have to also focus on not only just on getting them back to life, but actually making them participate in marathons if they want to. So, and we've heard about this, and there are so many cardiopulmonary patients who are going and developing and training themselves to go into competitive sports, which is really good. And we have to be the main pillars for them. So when we say it's the space, the equipments, the monitoring devices, and the HR cost. So when we talk about space, it basically depends on the scale of the project that you have, right? It is what are you willing to invest. So when we look at the space for equipments, the monitoring devices, the group activities or yoga sessions if you want to conduct, so the space has to be such a way that you can accommodate at least one equipment and a little open area for movement and group activities. That's the ideal space that you would have. But again, as I was mentioning that it all would depend on your willingness to invest. So it can range from about 700 square feet to say 5,000 square feet. So I've worked in almost all, right from Asian Heart, I'm sure everybody knows, but Asian Heart has got close to 1,000 square feet of area. And most of the Mumbai hospitals also, like HN, also has got a huge area for cardiac rehab, cardiopulmonary rehab. The centers which I have worked in Pune, like Dinanath Mangeshkar, and the studio where I was the founder member, had a huge setup. We've tried to invest in the space and the equipments and the monitoring devices. So it depends on whether to be, and it also depends on whether to be, as I said, to extend it into a comprehensive rehab. So not just the secondary prevention, but the preventive health of the preventive health part of it. So prevention, fitness, and to fitness to diabetics, hypertensive, stroke, geriatric, because all these conditions, as we know, are they go hand in hand. You cannot really isolate anything. So usually an individual suffering from, say, who has undergone a bypass surgery may have pulmonary condition, who would be a geriatric person, who would have a history of stroke, his family history or history of diabetes and blood pressure. So it's a a holistic approach that you really need to give when you're prescribing or doing an exercise prescription, along with the other systems, for example, the medical management. So to be in coordination with the main primary physician, and then of course the nutritionist, the psychologist. So everything has to be in coordination. So all this will be taken into account if you want to invest in a center where you have all these things under one roof. So when we talk about equipments now, this is the basic list of equipments. And as I said, depending on how much budget you have, you will have to decide on how many equipments or how many treadmills, how many cycle ergometers you want to purchase, and then do it accordingly. But if you see in any setup, you need these basic equipments that you can list it. So a treadmill, an ergometer, an elliptical, right? So then of course you need a multi-gym where you can do a lot of strength training in one area. And of course you need dumbbells and weight cuffs and mirror, and you need a Swiss ball and the basic physio related equipments that you really need. You need to have a sports floor and yoga mats for yoga and meditation and stuff like that. But these are the basic equipments, and the pricing, it ranges from region to region. It ranges from the company to company. So there's a wide range of prices right there. So you'll have to really sit down and work out what your budget is, how much space do you have, and then how do you want to lay it out, and how many equipments do you want to take, and then accordingly place them. But I think these are the basic equipments that you need along with the emergency equipment if it is going to be a standalone center. So that's again one of the investment that you really have to think of, that you need to have a crash cart with defibrillator, with the suction machine, and basic dressing materials, first aid material. So all these things along with the stretcher. So all these things which you need to handle an emergency at your center, so that you can stabilize the patient right there. And of course, the staff, the employees should be well qualified for the same. And then you'll have to list out the closest tertiary care hospital where you can actually move it through a cardiac ambulance. So the cardiac ambulance, the numbers, the contact details, and the entire flow with the emergency exits. So you really need two emergency exits, mainly two exits and one emergency exit when you are having a center of a standalone center. So now this was just to mention shortly, but this is the advanced equipment that I had used, and I had been to Germany and seen certain European rehab centers which are using Argoline, and it's a beautiful center, beautiful monitoring system where it offers a full series of devices for conducting control training sessions. And you got a telemeter where which is wrapped on a chest belt, and it is connected to the ergometer and a central screen where you can actually not only see the ECGs and the vitals what that you put, but it is a software controlled mechanism where you can actually control the ergometer speed, or if you put in, for example, a heart rate control mode in the software, then you can actually put a target of heart rate. Say, for example, if the person shouldn't go beyond 120, then it will sense that way and it will get that speed automatically down when the person reaches a certain heart rate. Or if you want to get it into just a training mode, then there are so many various modes of software in that thing, but it's extremely expensive. Again, it all would all depend on how much of investment that you want to put in, because the monitoring devices would be the ones whom you really need. If you need a cardiac rehab setup, you need monitoring devices. You need devices because there are multiple patients you would be seeing at one time. It's not an individual one where you can actually go look at the heart rate manually and look at the BP and this manual. If you want to see like 4 patients or 5 or 10 patients together, then you need a monitoring system where you can actually monitor them well. So this was just a brief about Argoline. And I thank you, Argoline, for all the support that I had from them in my last venture. So what are the other other monitoring devices which are normally used and more cheaper and more accessible? As I'm sure all of you know, that there are, again, the prices vary widely, but majority of Mumbai and Pune setups where I've actually worked more, and in the United States there is a different set of companies which does not exist here, but majorly Pune, Mumbai, if you see, then these are the monitoring devices which are usually used and which are equally competent and user friendly. So Philips, Gemini, Fourth Frontier. So these are the wireless monitoring devices. And since it is the wireless one, you can actually have a fitness assessment even during the 6-minute walk test if you are conducting. It also has this arrhythmia detection sensor, and again, it's connected to either a computer screen, or sometimes the latest ones are actually app based. So you can link it to any device you want to, either iPad or your phone itself. So you can actually connect it to whichever devices you want to, and it becomes very user friendly to actually monitor a person's progress. So these are the basic companies which are commonly and established ones which are being used in almost all the established cardiac rehab centers. So as I was saying, we have to broaden our perspective and look at as a team effort where it is not just exercise training, but it is lifestyle modification that we have to look at, and not just monitoring a patient from an exercise perspective, but it to be like an active team member with all the other disciplinary teams. So as you can see, exercise training would always will always be resistance training, stability training, coordination training. Nowadays, there are pneumatic compression, pneumatic strength training equipments that we have. So HUR is the company which usually provides. I think most of the Mumbai rehab centers have, and I have used it myself, which are good strength training or resistance training equipments, which can be a step ahead of for advanced technology, and it's a good company to work with. So so strength training, cardio, all these are a major part of cardiac rehab. But smoking cessation, blood pressure control, diabetes control, risk management, basically, weight management, obesity, and stress management also needs to be looked at. So questionnaires again become a major part of a cardiac rehab center, which we should not forget, because this is something which is going to give us functional improvements. I've personally used SF12, which is like really a short and sweet and accurate measure for functional gains, because all the other parameters possibly are can be modified with medicines. In fact, I had done a study when I was at Dinanath, and there was a retrospective analysis of all the patients who had attended cardiac rehab, and I had presented that in IMA, and I had won a prize for the oral presentation. But it actually had me look at these parameters which are strictly related to exercise. So when we say HDL, which is not again bothered, which is not related to your medicines, to HDL, your weight, your functional gains, so SF12, and your cardiac readmissions. So all these are the main pointers for your effective cardiac rehab program. And questionnaires is something which we should not neglect, although we have the equipments, we have the monitoring devices, but SF12 is again a monitoring device, I would say, which monitors a person's functional progress, and which we should have that in our mind. Floor plans, it's very essential how you place it. And again, it is designed depending on numerous variables. When you are in a hospital setup, you have to try and make sure that your department or your setup is closer to a cardiology setup, or it is either closer to an emergency area, or an access to an emergency area. And the floor plan has to be designed in a way that there is enough room for movement as well. So you need a mirror, a huge mirror, which is, I think, the major part of our rehab department. You have to have a big mirror in your department, and along with the equipments and the monitoring devices and a central screen where you have the telemetry monitoring done. So all these, the floor plan has to be really precise. And if you get a chance to kind of be in the floor plan management right from the beginning, then it becomes easier to go ahead. So yeah, I think I've covered all that. Adequate room for multi-gym and strength training equipments, again, is the key to it. So these are the points which we have to really consider. But again, as I said, everything mostly depends on how much of budgeting you have, right? So cardiac rehab, I love this statement, so I always put it, it doesn't get easy, you just get stronger. So thank you. I think I tried my best to put down in a brief time all the practical points that we need to set up a department in either a hospital-based or a standalone center. but any questions are welcome. Over to you, Dr. Prajakta.
Thank you, Dr. Asawari. Indeed, it was seen through your presentation that whatever you were talking about, you have learned it through your own journey, through your own experience, that
Yes.
you must have faced a lot of hurdles, as you mentioned, that when you started off that time, especially phase 2 rehabilitation and for cardiac and pulmonary rehabilitation was not really heard of. Nowadays,
Yes.
a few of the hospitals are going into that arena, I think since last 5 years, maybe.
Yeah.
Let's say 10 years, but before that, even I think in hospitals in metro cities like Mumbai and Pune, there were very few centers who were working into phase 2 rehabilitation.
Correct.
So I think the long shift of paradigm from entirely acute care or hospital based rehabilitation to OPD based rehabilitation. But I think in this era of non-communicable disease, where the incidence of lifestyle disorders like diabetes and hypertension, cardiac diseases, as in ischemic heart diseases, is rising. I think in the community settings, as the number of patients are increasing tremendously, I think this is a very important aspect of healthcare and physiotherapy, which has to be, which has to come up.
Yes, and it has to be more broader, in a more broader way. I feel all the new generation physios have to be, they have to go beyond just a routine cardiac rehab, but they have to go into a little more towards fitness. So, I mean, they themselves have to work on their own fitness first. So, if you want to teach a person who has undergone bypass how to do a squat, and you yourself don't know how to do a squat, then there is no connection. So even the patient won't connect with you. And we being cardiopulmonary physios, we already know so much in details, and we've already learned so much in details about muscle anatomy, heart, lung, all systems, that we are the best people to integrate everything and be the fitness experts. So we have to try and look beyond just the cardiac rehab, which is just this immediate rehab, but try to make the patient into a fitness zone totally. So that should be the goal, rather than just a secondary rehab or just an immediate rehab.
Correct. As correctly mentioned, that cardiac rehabilitation becomes the secondary prevention aspect of it. But nowadays, again, the focus is shifting towards the risk factor management and
Yes.
maybe a primordial prevention.
Yes.
When the risk factor is not there and you are trying to tackle it, because I think nowadays everybody has got a first degree relative who has got diabetes or hypertension.
Yes.
Or
correct.
So I think that way everybody is at a risk. So if people identify themselves as candidate and they start today only in such a center where a fitness expert or a physiotherapist or cardiopulmonary physiotherapist is advising them, giving them lifestyle advice, then I think it is the apt setup or apt advice they can get from.
Yes.
Especially,
Yes.
and I think healthy individuals, they can get this advice anywhere. But then when it comes to a person at risk, maybe a diabetic or a hypertensive,
Yes.
I think that supervision is absolutely necessary.
Yes.
Because
Yes.
adverse reaction, even though the percentage is small, but what if they occur, they could be very devastating.
Correct. And we should be the ones who are taking the lead in it.
Correct. Right. Asawari, I had a couple of questions that you spoke about various equipments which can be there. But I think for our subscribers and the young people who are probably looking up to starting up at least a basic setup, what kind of financial considerations am I looking at? So maybe a couple of very basic and must-have equipments and whatever your safety equipments in terms of life support. So what is the minimum cost involved into it? So what kind of financial budget or funds they need to have when they are considering for such a setup?
Yes, Prajakta. So the question is easy, but I would say the answer is really difficult, because the major chunk comes from your space.
Right.
So the space that you take, where are you buying the space from? So the location of the space, it's rent.
Right.
If you're taking loan for the same, then it's EMI. So major concern is about space, whether you're renting it or whether you're taking it on your own. So that is the main budget part. Then the equipments can be modified. If you want to just have like one treadmill, if I just keep the space rent apart, then if you just look at just one treadmill, one bicycle, and some basic strength training equipments, not a real multi-gym, but just dumbbells, therabands, yoga mat, and some floor exercise, so Swiss ball. So these are the small basic equipments which actually can be wrapped in just around 1 or 2 lakhs, I would say. So you can actually just wrap them up with just couple 1 or 2 and just 1 or 2 lakhs you can just wrap it up in. But the monitoring devices, now again, the monitoring devices of say if you're taking Philips or if you're taking Fourth Frontier, this price again I've seen it varies so much. There's so wide range in Mumbai and in Pune. So I'm sure it would be different for different regions. I don't know. It should have been a standard pricing, but there is a little difference in each pricing. But I would still say if you are keeping your space rent and space separate, then you can have a very, very, very basic setup in about 4 or 5 lakhs. And then, of course, the major chunk is space. Even if you ignore it, it is the space and the space rent.
Correct.
And then the HR cost, if you want to employ somebody. If you don't want to employ anybody, if you're on your own, then you are the own. But these are the very basic things. Now, again, when I was saying a standalone center should ideally have a crash cart. So the crash cart, defibrillator, all those emergency equipments again bump up your budget. Yeah.
Correct, right. So it is basically customizable depending on how much you are willing to spend, and
Yes.
basically what is, as you mentioned, the realistic price where you are practicing in.
Yes.
You also mentioned during your presentation that especially for a standalone centers like that, there are a lot of barriers. I think one of the barrier could be the awareness amongst the community, especially about the phase 2 or rather fitness training. Usually people are ready to pay on the restaurant bills, but when it comes to healthcare costs, people are a little hesitant about it, especially if insurance is not covering, as you mentioned.
Yes.
So in such a scenario, what could be, I wouldn't exactly say call it a marketing strategy, but when you're or I would say rather outreach. So what would be your outreach strategy, especially if a new person is setting up their own setup? Because setup will be there. Setup is where you can, like in setup, after setting up, how to reach, what are going to be the outreach strategies for?
Right. You'll have to work a lot. There actually has to be a separate budget. When you're having a standalone center, it is about the space. Of course, it is about the HR cost. It is about the equipments. But yes, you will have to have a major chunk of your budget kept for your marketing. Because since it's a standalone center, you'll have to get connected to your, of course, and the close by physicians and cardiologists and cardiac surgeons and whoever doctors you know, because the referrals would come from them. But majorly it has to be a direct referral. So for the direct referral, you will have to create awareness of your center by using social media. So you'll have to do a lot of social media activities, do a lot of camps, give newspaper articles, or take up a radio media package. Everything is according to package what you want. So you will have to keep a budget ready for your, which is a very good question you asked. I missed that in my presentation, but yes, it does play a very important role to outreach, because there are so many centers now. But a cardiac rehab center, if you a standalone center especially, you will have to have a good social media coverage. and an outreach program for it.
So social media as in Instagram, Facebook, or your, so how
Yes,
would we
yes,
use?
various social media. So digital medias and print media, and even radio, I would say. So all the medias, whichever fits in your budget again. So I've used almost all these medias in some or the other way. But if you see radio and if you see newspaper also becomes really costly these days. Especially now after COVID, they have bumped up their prices a lot. So you will have to keep a separate budget for it. But digital media, I would say, is the most effective outreach, safest, cheapest way to reach out to people whom you know, to let them know that you're opening your own center.
Right, correct. So as you mentioned, it is basically the planning has to be there. You have to very judiciously plan your funds. You have to
Yes,
allocate some budget, that how you're going to develop your outreach strategies.
yes,
Then
yes,
what kind of, and I think that outreach strategy would also depend on where you're setting up your clinic.
exactly,
So who's
exactly,
going to be your target audience? So are they going
exactly.
to be the people who read newspaper? Are they likely to be the ones who are
Correct,
using social media?
correct.
So
So you
I think
need to do a market research for the area where you're opening out the clinic. So that will all depend on what is in, as you say, in that area.
right. Um, Thank you so much for answering my queries, and thank you so much to be one of our speakers for PhysioTV. Would you like to give some message for our new generation physios who would like to set up their own probably cardio rehab centers?
Yes. Thank you very much. Even I'm so much pleased and honored to be here on this platform. And I tried my best to keep it more practical oriented and more to the point of the presentation. But yes, the main message that I would like to give is we'll have to work as physios, as cardiopulmonary physios, beyond the just a rehab team. So you have to start looking it as, because fitness industry is growing so much, that we have to kind of blend with that into more of lifestyle modification, more of a holistic approach where you're advising them an entire lifestyle modification depending on their nutritional status, their stress management, their other factors. So you've got to be a lifestyle coach for them, not just being an exercise therapist, but a lifestyle coach for them, which is going to take you more ahead in your journey. So
Right.
yeah.
Thank you so much. And thank you so much for introducing me and everybody to this terminology, lifestyle coach. This is indeed a very interesting one, that as a
Yeah.
physiotherapist, we are not just prescribing exercises, but we are suggesting a lot of lifestyle changes to
Yes.
these people.
Yes.
And I think which are very, very important from prevention of future events, from overall
Yes.
improving the health and fitness. So again, thank you so much, Dr. Asawari, and
Thank you.
also thank you so much to our management who have always supported this venture of PhysioTV. And thank you so much to our viewers who always are there and who appreciate our initiatives in PhysioTV. Thank you so much. Stay tuned for our future PhysioTV sessions.
Thank
Have a
you. Thank you very much. Bye-bye.